Hi there, this is Dr. Paul and thanks for tuning in to this video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about dental trauma. The reason why I think this is going to be a very important video is because I want this to be easily accessible to anyone and everyone on this website in case a dental emergency has occurred. So let's talk about the first one, which is where your tooth has completely come off your jawbone and is either lying in the palm of your hand or on the floor somewhere. The first thing to do is don't panic. Pick up this tooth, clean it up either with distilled water or saliva or even milk. If you don't have any of these and you have only tap water available, go ahead and use the tap water, but very quickly. And once you're done washing away the debris or the dirt, use either the saliva or milk to kind of soak away or rinse away the tap water. Once you've done that, either put it back into the socket of where you've lost the tooth. If you're not very confident about orienting the tooth back into the socket, which basically means you don't know which way faces the right way, don't put the tooth back into the socket. Bring it to the dentist or to someone who knows what to do in a bowl of milk or saliva, and then he or she can orient the tooth back into the socket. The very important reason why you don't want to put it into the socket is because if you put it in the socket without knowing which end is up, so to speak, the tooth will fuse the wrong way, and then you will need to go through a root canal to change the morphology of the way it looks. Now, if you do end up having the situation where the tooth is out, you have to understand that within 20 minutes, the tooth has to be transported in saliva or milk to the dentist. If you don't have a bowl or if you don't have a cup to put the saliva in, you can just ask the person who's lost the tooth or the tooth has come out of to just lift his or her tongue, put the tooth underneath there, and you can basically bring the tooth in that way. So this is the most important or the most severe kind of dental trauma. The second dental trauma is where the tooth is affected by force, is extremely wiggly but still is in your socket. In such a situation, just make sure that you don't keep wiggling the tooth more with either your lip or your tongue, and you use your fingers to put the teeth or the tooth back into place and keep it there. Go over to the dentist's office as soon as possible, and the dentist will try to splint the tooth back onto your the proper area and use your other teeth as a support or guide. So this is the second severity or the second cause of dental trauma. The third, I would say, is if you have a hard concussion on a tooth and the tooth feels very numb, but that's pretty much it, which means to say that it's not really loose or it hasn't come off, but it just feels like it's been traumatized. In such a situation, just make sure that you don't re-traumatize the same tooth and that you get to your dentist as soon as possible and let him or her know that you've had a pretty bad dental concussion. The dentist will run a couple of tests, not on the day off, but will keep following up on the tooth and periodically check if this tooth is getting discolored in the course of time, which basically means that there's been bleeding within the canals or within the blood vessels inside the tooth, and then the dentist has to figure out if the tooth is still alive over a certain period of time. Now, what usually happens with a dental accident or a dental trauma is there's so much of bleeding and there's so much of pain involved that sometimes it's very difficult to remember the right things to do or the right steps to take. The most important thing to do is make sure that you're not in any dangerous location or a dangerous spot where more than dental trauma, accident or bodily injury or harm can occur. So make sure that you transport yourself or this person away from that site. And once this has happened, then focus on the fact that the tooth needs to be saved, either by saving it in saliva, in milk, or even in the socket, and head back to the dentist. The most important thing to understand or remember with dental traumas is the effects of dental traumas can usually come after years and years. And what that basically means is once the tooth is back into the socket or it's not mobile anymore, that doesn't mean to say that the tooth will never have a problem in the future. A lot of times there might be different things that happens to this tooth. There might be something called resorption, where the root of the tooth is being damaged by the bone. There might be something called ankylosis, where the tooth is fused with the bone, so there is basically no way the tooth can move, and even if you need to pull the tooth out from for any kind of extraction reason, for any kind of infection, it's going to be very tough to do so. Or even there might be situations where the tooth ends up getting discolored and still stays vital or still stays alive. So I hope these have answered a couple of your questions regarding what to do during dental trauma. If you ever are in a situation like this, try to reach us in our office at 613-966-1225. And if we are not available, leave us a message and we will try to get back to you as soon as possible. Thanks for watching.